Welcome to the Physio News Network July 2025 edition, where we blend cutting-edge research, clinical innovation, and real human stories to inspire better rehab and recovery for you. I'm your host, Giri Srinivasan, Registered Physiotherapist, clinic leader, and advocate for holistic, evidence-driven care. Today's episode is all about breakthroughs in research, in technology, and in mindset. So, the first topic in our PNN is always research roundup. We're going to talk about two researches which is very valuable and make changes in your lifestyle and your rehab. Number one is Achilles tendinopathy. Very common thing, most of you will hear about it. A shift in thinking. First up, a fresh perspective on insertional Achilles tendinopathy. It can happen in the insertion where it attached to a heel bone, that's called insertional Achilles tendinopathy. A new study shows that traditional eccentric loading, while great for mid-portion issues, often fails in insertional Achilles tendinopathy. Instead, a low tendon compression rehab, we call LTCR, that approach delivers better outcomes. Less pain, improved outcome measures, better patient satisfaction. Low tension compression rehab and exercises involves limited dorsiflexion, you're not bringing up too much, no stretching at all, and providing heel lifts. A gentler but smarter path for active adults struggling with chronic heel pain. Again, summarize, if you have insertional Achilles tendinopathy, do not do too much eccentric exercises and do low compression exercises. Next, whiplash. What are you going to talk about whiplash? The overlooked nerve. We dive into whiplash associated disorder. While it's often thought as a musculoskeletal issue, this study found that acute nerve injury is surprisingly common, even when clinical signs are subtle. Especially when you're in a car accident, when you're a whiplash, you always check for neurological signs. So the take-home message, look for neuropathic pain early. Use pinprick and thermal sensory testing when you assess a patient. Tailor management accordingly. So it's time to stop missing the nerve and start treating the root cause in whiplash injury for patients who are undergoing sports injuries or motor vehicle accidents. So those are the two research reviews I want you guys to know. Next, we are going to segment 2, which is clinical practice guidelines. Let's talk about strength and why no pain and no gain might need a reframe. A recent 8-week study tested light load bench pressing, actually about 40% of your one arm, in two groups of untrained individuals. One group trained to failure, the other group stopped with 5 to 6 reps left in reserve. So what happened? Why it is important for you when you're working out in the gym? Key clinical practice guideline here is the muscular endurance improved significantly in the failure group. There's a slight hypertrophy also happened when you work up to the failure, particularly in the pecs. Strength gains roughly the same in both groups. So that's what you need to know. So here's the kicker. Stopping early saved energy while delivering the same strength gains as working out to the failure. So if you're going to gym regularly, if you're working out to the failure every time, it's not going to make much difference in the strength gain. So what does it mean for our clinical decision making? Training to failure can boost muscular endurance, may help slightly with hypertrophy, but it is not required for strength improvements. So in rehab and performance, it's not about chasing fatigue, it's about matching the method to the goal. Will your client chase the burn or train smarter, not harder? As clinicians, our job is to ask what outcome do they need and what's the most sustainable path to get there. That's what we need to focus on. So our next component of our Physio News Network for this July edition is Innovation Corner. We're going to talk about high intensity laser therapy called as HILT, H-A-L-T. Let's talk tech. High intensity laser therapy is emerging as a powerful tool in modern physiotherapy. By delivering deeper tissue penetration, it promotes faster healing, reduced inflammation, and pain relief, especially in tendinopathies, whether it's shoulder, knee, or ankle, osteoarthritis, and spinal pain, whiplash injuries, all these conditions. It is non-invasive, it is patient-friendly, and pairs beautifully with manual therapy and movement exercises and also your strengthening exercises. So check out if you want to approach or access high intensity laser therapy. We do have in one of our clinics, it's called West End Physical Therapy in the West End, and you can call them and make an appointment to get benefit out of that. Segment 4, success story. We're going to share one of my patients' success story, Joanne's story. healing the whole person. That's all it's all about. Let me tell you about Joanne. She came in with stubborn upper back and knee pain. She's gone to several therapists, chiropractor, exercises, tried injections, medications, everything. Nothing actually stuck. So I was assessing her the other day. Then I took a little different route, the holistic route. I asked her about her mental health and she just broke out of tears. I asked her about social life. She again went into tears because she disconnected totally. Her sense of connection is totally lost. What came up is loneliness, grief and disconnection. So we brought in our mental health and wellness team, referred her to a psychologist, and she started to shift. Her pain eased. Along with physiotherapy, manual therapy and exercises, her mobility improved. She also joined a walking group and also started enjoying her life again. Joanne's story is a proof that healing is rarely just physical. It's always personal. So when you assess a patient, please look more into rather than just bones, joints, tendons and muscles. Next component we're going to talk about exercise. The exercise of the month is half kneeling chops. Half kneeling chop with a medicine ball or a kettlebell, you can do with anything you want. This exercise is a gem for core control, rotational stability, shoulder and hip dissociation, which is very important in a lot of cases, especially golfers and rotational athletes, and real life and functional movement. It's rehab meets performance. Ideal for any athletes, sports performers, post-op patients, athletes and seniors. Especially for dynamic hip stability is the exercise I go usually for dynamic hip stability, for balance and stability training. So that wraps up our July edition of the Physio News Network. If you learned something today, share it with your team, with your clients, your community, because better knowledge builds better outcome. So until next time, stay inspired, stay evidence informed and stay human. This is Giri Srinivasan signing off from Physio News Network. Bye.